Hello everybody, my name is Eric. I'm a student for William Patterson and I'm presenting this conference to impact of hand hygiene education and the nurse complaint rate. This is a study for 6 months, 6 month study for this hygiene education. Hand hygiene is crucial in clinical settings has significant impacts, patient safety, and reduce healthcare associated with infections. These infections contribute to increased morbidity, mortality, and healthcare costs in the world. Proper hand hygiene involves the use of soap and water on hand sanitizer, either recognized is most effective means of prevent the transmission of pathogens. However, despite the emphasis on hand hygiene remains a persistent challenge. The World Health Organization report that is a significant proportion of hospital patients, regardless of country development status, acquire at least one infection in the hospital or institution. This is not only affect patient outcomes, but also compromise the overall quality of care provided in healthcare facility. Nurses being a bed from her of patient care play a crucial role in preventing the spread of infection. Their adherence to hand hygiene guidance in essential is reducing the transmission of pathogens. By complying with hand hygiene practice, nurses contribute to ensuring patient safety and meeting the risk of infections. These studies aim to address the need for effective strategy to improve hand hygiene complaint rate among the nurses. Consider the uncensored surrounding the effectiveness of current educational programs with limited evidence. Able on the impact of the education intervention on nurses' complaint rate. The study is to fill this knowledge gap and provide valued insights. The primary objective is to evaluate the effectiveness of hand hygiene educational programs, improving complaint rate among nurses. By assessing the program impact on the charging nurses' hand hygiene practice, the studies aim to contribute to evidence-based strategies for promoting hand hygiene complaints among healthcare professionals. Ultimately, the study goal is to enhance patient safety, reduce the healthcare associated infection, and provide the overall quality of provided by nurses in healthcare settings. This study seeks to determine whether the implementation of the educational program on hand hygiene has compared to standard practice can result in improving hand hygiene complaint rates among nurses with 6 months. The research question concentrates on either the educational program implemented results in increase in hygiene complaints among nurses. The purpose of the study is to evaluate the program impact and effectiveness in reaching hand hygiene practice within the specific time frame by comparing it to the standard practice. The purpose and the research question of the study are current in examining the potential impact in the educational program on nurses' hand hygiene complaint rates. This study employs a quasi-experimental design with two groups, intervention and control. In order to provide hand hygiene practice, nurses in the intervention group will receive an educational program consists of educational session, training, material, and practical demonstration. The nurses in the control group, on the other hand, will continue to follow standard practice without any additional intervention. The purpose of the study is to compare the outcomes of these two groups in order to assess the efficacy of educational programs on hand hygiene complaint rates among nurses. The investigation will be conducted in the three phases. In the pre-intervention phases, complaints rate with hand hygiene will be measured among all participating nurses to establish a comparison point. Next, during the intervention phase, the educational program on hand hygiene will be implemented for the intervention group nurses. This program consists of educational sessions, training, material, and practical demonstration among enhancing hand hygiene practice. In the post-intervention phase, complaint rate with hand hygiene will be measured a regular interval of for 6 months. This will enable the evaluation of any change or enhancement in complaint rate after the implementation of the educational program. The quasi-experimental design of the study will permit a comparison of hand hygiene complaints between the intervention and hand control group. By measuring baseline rate, implementing the program, and monitoring complaints over the time, it is possible to evaluate the efficacy of the intervention. The research is conducted in a hospital or clinic. Their hand sanitation is essential for patient safety. There will be two categories of sample, the intervention group and the control group. The intervention group will consist of 50 nurses from a specific unit or department who will receive an educational program on hand hygiene, while the control group will consist of 50 nurses from the analogous unit department who will continue to follow the standard practice. Registered nurses actively working in the design unit of the department will be included studied to ensure their direct involvement in the patient care. To maintain consistency in data collection and minimize the potential confounding factors, nurses on leave or with extended absence during the study period will be. The study revealed the hand hygiene complaints rate in the both and the intervention control group at various time periods. The intervention group comparison rate will be tracked monthly to measure the impact on the institutional program, where the control group rate with severe hazard baseline. To assess to the program performance, complaint rate will be compared between the two groups to establish the significance of any difference detected. A statistical analysis procedure, such as the check-quit test or t-test, will be used. The information will be clearly presented in tables or graphics, allowing for easy interpretation and comparison of complaint rates over the time. The discussion mostly focused on the interpretation of the study result. It will examine in the hand hygiene instruction program improving complaints rate among the nurse in the intervention group. The data will be compared to the complaint rate observed in the control group of establish the educational program effectiveness. Any notable discrepancies in complaint rate between the two groups will be higher and the implication for promoting hand hygiene will be investigated. Furthermore, the discussion will focus on the study finding in the context of hands cleared among nurses. The student found that we underscore the usefulness of educational interval in improving hand hygiene complaints based on the finding potential measures to increase hand hygiene complaints among nurses may be offered taking on the account of effectiveness of the institutional program. The discussion we also explored the study limitation, has potential limitation, the sampling size and generalizability to other health settings will be addressed. Furthermore, relevant confounding factors may have influence to the result will be examined in order to provide a true understanding of the study limitation. The realities of the self-report or observation methods for evaluating complaint rate will also be identified as a drawback. We complain for accuracy, the result discussed. The conclusion will provide a succinct review of the main findings and the study. Dressing on the key outcome relating and hand hygiene complaint rate in the intervention and the control group. This summary will be provide a concise summary of the study findings. We also focus on the impact of the hygiene instruction program on the nursing complaint rate. High clean entity notary improvement of disparities in complaints rate identified between the intervention and the control group. The student finding will be discussed in terms of either compliance for nursing practice and practice safeties in the conclusion. We emphasize on how the implementation of hand hygiene instructional program can contribute improve the hand hygiene complaints among nurses, thereby improving patient safety in healthcare settings. It will also highlight the significance of ongoing education and training program in order to preserve the improved hand hygiene standard in nursing practice. Over at the conclusion, we provide a clear and succinct review of the study findings, concentrate to the influence to the hand hygiene training program on nurses, compliance rate, and emphasize the significance of these findings for nurse practice and the patient safety.